Hola Gmma, my name is Sarah Mayer.
And I'm Brendan Mayer, and we are the co-founders and directors of Siloe Ministries in Baja, Mexico. And we wanted to start off first by just saying thank you, Gmma, for the opportunity to share with you and your student chapters a little bit about our ministry and some of the challenges that we're facing in Mexico this year.
Throughout the years, we have formed many valuable relationships and friendships with Gmma students, staff, and leadership that we're grateful for. And we know this past year, because of the global pandemic, a lot of things have changed. But what we're thankful for is that a relationship with Gmma and your willingness to stand beside us and support us has not changed. Since 2008, we have run a community medical and dental clinic in Baja, Mexico. Our clinic is located in a rural village called La Misión, about 1 hour south of the U.S. border. We offer members of our community free medical and dental care, and last year we saw more than 10,000 patients, ranging from newborns to the elderly. We are open 4 to 5 days per week. Our team of 10 individuals include both Mexican and American healthcare professionals, including a full-time doctor, and we have several volunteer professionals on our staff as well. In addition to family medicine and dentistry, we also offer our community specialist consults, physical therapy, occupational therapy, chiropractic care, one-on-one nutrition coaching, and exercise classes. But what really sets Siloe apart from other nonprofit clinics around the world is our emphasis on whole person care. While our patients' physical well-being is important to us, we know that ultimately their spiritual health is what matters most. So we provide free Christian marriage and family therapy to our community, and we have a trained prayer team that lays hands on our patients to pray for them on a regular basis. Everything we do at Siloe is geared toward building relationships in our community so that we can share the love of Christ and draw our patients closer to God. It has been a privilege to serve La Misión in Baja for the past 12 years, even during trying times like what we have experienced this past year.
2020 has indeed posed numerous challenges for our ministry. The pandemic has hit Mexico very hard. In fact, Mexico has the third highest death toll in the world from COVID-19, and its health systems have struggled to cope with the challenge. Like so many organizations around the world, when COVID-19 began impacting our region this past spring, we had to figure out how to reduce physical contact with our patients while still providing the services they rely on. So the first thing that we did was to implement a contactless medication refill program. Patients can come to the clinic to receive their essential refills on an appointment basis, picking up medication and instructions while social distancing and without risking exposure. Many of our patients are elderly or have pre-existing conditions that would put them at greater risk from the virus. So since April, we have been providing telephone and telemedicine consults for our highest risk population. In-person medical visits at Siloe currently all take place under tents outdoors. Thankfully, we have a climate here in Baja that will allow us to continue conducting outside care nearly year-round, and our 1-acre campus provides plenty of space for our team to see patients in the safest possible way. While we never would have imagined what this year had in store, it's been amazing to see how our team has pulled together and come up with creative solutions. And God has continued to move in the lives of our patients and use our ministry as an important vessel for His love, even through this strange and trying season.
We know that Gmma has hundreds of prayer warriors, and we want to ask you right now to support Siloe and our patients in your time of prayer. Many of our patients are suffering economically because of the global pandemic, and we would ask that you would remember their physical needs in your prayer time.
Another challenge that we would love your prayer with is how to navigate this COVID-19 crisis so that we can still provide essential care to our patients and, most importantly, connect them with Jesus during a time when we can't have as much contact with our patients and when there's physical distancing in place. And so we have to get creative in the ways that we interact with our patients and the ways that we relate to them. So we'd love your prayer as we navigate that in the coming months as well.
Thank you so much, Gmma, for remembering Siloe. We look forward to seeing you again sometime in the future here in Mexico. Que Dios les bendiga.